Welcome, Jono. Thank you so much for coming on today.
Yeah, I'm thrilled to be here. Thanks for having me.
Well, let's start from the beginning. As another physical therapist, I always am curious how you decided to become a PT. How did you want to get, what inspired you to get into this profession?
Yeah, it might be well, I was going to say a boring story, but maybe a common one within our profession. So I was a college athlete. I played soccer, and so my decision to for the school I went to was purely just on the soccer team they had. And so the degree my freshman year was an afterthought, but I was excited about exercise, right? Like I'd exercise basically every day of my life. And so exercise science seemed like a good fit. And then I got into kind of halfway through my sophomore year, and my advisor was like, you can't really, um, well, the exercise science degree maybe doesn't translate to the marketplace as well as some other degrees, right? I loved the degree and what I was learning, but it was just a natural progression to go into physical therapy. So I shadowed, and physical therapists seem to love what they do, and they got to work with people in a way that got to connect at a deeper level than just like maybe your traditional healthcare provider interaction, and still understanding the body and kind of to a deeper level how we move and how we function. That was fascinating to me. And so fortunately, I got into physical therapy school and got to go down that road. And yeah, I kind of took some tangents here and there, and it created my own path in this headache and migraine world. But yeah, that's the short of it.
Well, it's interesting because yes, I think a lot of PTs are like you, and me. Like I had always loved movement and loved the physicality of it, loved the body, loved health and wellness, and probably like me. Maybe I'm assuming, but I feel like a lot of people think like if you came from a sports world, you're going to go and work in a sports world, like sports medicine or orthopedics. Was that part of your path, or did you immediately start to find this kind of alternative part of PT, which is actually relatively, I think, a small niche?
Yeah, the sports medicine world was attractive to me. I don't know. I think I went through phases within physical therapy school. I don't quite remember the timeline of it. When I started, all of it was just novel. And so I was excited about kind of every aspect. The clinical experiences really, shaped what I was interested in. The sports medicine world did seem a bit more attractive. Even before school or in my program, I got connected with a few manual therapists in the outpatient world. And one of the things I was really looking for was just that the impact on the patient I was working with. I remember at one point I thought, man, why don't I go back to school for orthopedic surgery, go to med school? And because they feel like they're having the biggest impact on the patient that, whether I'm working within the hospital or just rehabbing their knee after. Not to devalue that side of physical therapy, but I just wanted to like have the greatest impact on my patient. And so I was attracted to these manual therapists because they really seemed to have a firm grasp on what they were doing. There was one gentleman out in Minnesota that people would travel from all around the state to come see him, and just very confident in his skill set and his ability. And that was attractive to me. So within the physical therapy program itself, like the sports medicine route was probably where I was at to start, but then that sort of evolved into probably just more general like spine health and manual therapy approach to things.
I love that. And I was similar. And then I went into neuro and older clients. So it was like a very different, I think it is all in a way what you're open to and also what you're exposed to and seeing, like you mentioned, the impact. So like with neuro, and I just saw there was and there was a lot of manual with neurodevelopmental training that was my specialization. And I loved that as well as versus I think sometimes in a sports medicine clinic, unfortunately, you're really reduced to quickly teaching some exercises that are kind of a standard cookie cutter. And it's hard because of insurance to do much more than that. With the manual therapy, was it that you were with one person that really showed you like this person? Was this the person that you were doing some kind of clinical internship with?
Yeah. So I didn't technically have a rotation with this gentleman, but he came in to teach a weekend course for our class. It was elective, so whoever wanted to go, and he taught it on the jaw and the upper part of the neck. So the biomechanics of the upper cervical spine, and actually, I mean, he taught us some techniques for the jaw, for the neck, kind of your basic techniques is if you're going to work on and treat these conditions, but just understanding the mechanics of it was really fascinating to me. Just the fact that our neck could hold up this 10 to 12 pound head, it'd be really dynamic. And for some reason, I could just be misremembering, but I really don't think we had much education in my program, at least I can speak for myself, on the upper cervical spine, the mechanics of it. And I don't think there was any connection between that and headaches. And so if I wouldn't have had that experience, I think I would have graduated with really very little to no minimal understanding of what it means to help someone with a headache. And so I'm grateful for that, because he was able to connect a few of those dots. And then I went and shadowed him during just kind of a free week that I had. And seeing him in patient care just got me even more excited.
Okay. So talk to us a little bit about the relationship of headaches and the cervical spine. I mean, I'm sure we have a lot of really intelligent listeners who know quite a bit about the body, but like you said, this is not even often covered in just kind of general physical therapy programs. What is the relationship? Why does this happen?
Yeah, if I had to simplify it down, referred pain is very common and it's known. So the most widely known area where we experience or understand referred pain is in a heart attack, right? So your heart is having an issue, it's not getting the oxygen it needs, and then you're experiencing the shoulder pain or neck pain. So there's nothing wrong with your shoulder or your neck. You're feeling pain there. And so the brain is perceiving that as what's happening. So when we think of pain, we have to understand it as being subjective. So the location of it, even the type of sensory input that we experience, can't always be trusted. So it's not like this one-to-one relationship. So if you have eye pain, we can't assume your eye is the problem. If you have temple pain, we can't assume your temple is the problem. So but in the Western medicine model, if you see a primary care doctor, go to a neurologist, they are functioning primarily off of that assumption that if you have eye pain, let's screen your eye, let's do an X-ray or an MRI, or send you to an ophthalmologist, and just if you pass all the screens, then we just need to manage the pain itself. Okay, so that's kind of the narrative. When we're connecting the neck to the head or the face, so anywhere from the base of the skull to C3, so the upper part of the cervical spine, anywhere in there can refer pain into the head or the face, okay? So we know this, they've injected that area and it refers pain into the temple or behind the eye. So those referral patterns are known, they're researched, they're out there. And so what happens there is an intense pain signal coming from the upper part of the neck travels through the brainstem. And if you really want to get into the neuroanatomy of this, it gets kind of fun, but the trigeminal cervical nucleus is this nucleus that kind of wraps up all of these sensory signals from the head and the face. So the trigeminal nerve, we've got these 3 branches, picks up sensations from our face, the occipital nerve from the back of our head, and then C1 through C3 up here in the top part of the neck. They all meet up in this nucleus in the brainstem, and then it sends it up through the thalamus, which is processing the sensory information. Then it hits the cortex, and we actually, our brain is trying to understand what's happening, and it oftentimes gets the location of the pain wrong, and even the type of input wrong. So these auras, I just did a podcast on what is an aura, and oftentimes our brain is just perceiving a pain signal as something else that's happening. And so that's kind of the short of it. The overlooked part of the upper, so if you think okay, the neck has a problem, and we do a CT or we do an MRI, it's a still image, and that's really the problem. And as physical therapists, as you know, we want things to move. And even in the chiropractic world, they're generally working off of, a still image of alignment or something like that. And so physical therapists are uniquely positioned to understand and treat this type of thing because the upper part of the neck is so dynamic, and the biomechanics of it are so essential to proper neck function. And when people lose that, that's where the irritation and pain comes from. And then we just experience that in our head.
Okay, so when they lose it, can you give some examples of losing that mobility or that ability to control the neck? Is this posturally related? Do they have to have had sustained something, some kind of impact to their head, or is this just like daily life?
Yeah, great question. It's kind of like all the above. So if I'm going to lay out what most of the time is happening, the most common scenario where it's going to be 2 to 3 times more likely that this is going to show up in a female, and likely kind of in adolescence. So this is me taking my clinical experience and understanding of the body and sort of telling a story. Okay. So as a child, our head is disproportionately larger than the rest of our body, and our neck is relatively unstable. And then we're pretty active, so we're moving quite a bit. And so I do think as a child, especially I see this in little girls that are in gymnastics or dance, like they're very mobile, and that movement's good and the exercise is good. So don't get me wrong there. But oftentimes their neck might not be ready to support those movements of maybe this 10-pound head that they're carrying around. It's about the weight of a bowling ball. And so that's one thing that it can add stress to the neck. And then over time, it's going to lead to this sort of pattern or these restrictions that we see. Posture is another big one. I mean, if you're sedentary, your head's forward. So even a 15-degree angle of your neck, as opposed to just being upright in neutral position, takes your head from feeling like a 10 to 12 pound weight to about 27 pounds to 30 pounds. And then that grows exponentially as your head continues to move forward. So when people are sitting like that, the stress that's placed on the neck is increased. And so that can definitely be part of it. Of course, trauma, whiplash injuries. So again, your head weighs about the weight of a bowling ball. So if you get thrown one direction and your body can't anticipate that movement quick enough to accommodate to it, it's going to lead to some shearing effect and some trauma in the neck. And then we've got some developmental things that we're seeing. So essentially as a child is raised and their jaw's developed and they develop sucking reflex, and we need to make sure their tongue is freed up to be able to develop the upper palate and that their airways develop properly. And if it's not, they do compensate by their head will thrust forward and their jaw will retract. And so we see these kind of compensations that will lead to increased tension in that suboccipital area, which we'll work with other providers to try to solve that as well. But we're seeing a lot of airway issues. But if I'm going to boil it down, it's either times on your side or times kind of against you. Mm-hmm. And so the assumption that I make is not that like you should go through life and everything's fine. It's you're going through life and there's gravity weighing down on you and physical stress. And if you don't do anything to counteract that, you're going to find yourself in a spot of having tension. Okay. So you don't really need like that, like trauma or that incident. It's just having a vacuum of like nothing to be helpful for your neck that can be enough.
Yeah. And to that point, I mean, I see this a lot in postural imbalances is people will be having servogenic headaches. They'll have fogginess, just like kind of brain fog, pain behind the eye, et cetera. And I definitely have found that it seems to be provoked at least by being sedentary, being out of alignment, whether it's that forward head, that tech neck. And how much do you think with the posture, with the head sliding forward, how much of you think is compromising just that blood flow exchange through the brainstem from the upper cervical spine?
Yeah, that's a really good question. I do know that there is some research to say that just mechanically a change in resting posture and tension built up through the neck can have an impact on blood flow. It's an interesting conversation. I think when we look at historically what headaches or migraines were attributed to, and maybe migraine in particular, it was assumed to be this vascular problem. And then there's a lot of providers currently that will claim like the increased blood flow is what is actually happening to reduce, migraine symptoms, things like that. Honestly, I'm not quite there yet. I think if there is a benefit of increased blood flow, that's a really good thing. I mean, blood to any system in the body is going to be helpful, and so let's get that benefit. My philosophy, or what I feel like, or what I think is happening, or believe is happening, that's really benefiting the patient, is probably more mechanical and actually reducing the irritant itself that's sending the pain signal. But yeah, it's a good question, and that thought of like, is blood not getting to my head is definitely out there. So it's worth
Or
considering.
even just with increased tension in the tissues, is there like some kind of, I mean, yeah, that itself can elicit a pain response. But it also feels like it's stagnant. Like if you are, I mean, I know, I call it the spackle that's right underneath right underneath the skull, that area that can just feel like you need to get in there. And I'm sure with your manual therapy, you help a lot of areas, and that must be one of them. But it's almost like the increased neural tension is also, whether it's blood flow or just perceived tension that your brain is thinking it as a threat, and that causes this alarm system of sorts, which might be in the form of a headache.
Totally.
And I mean, a
Yeah.
lot of times, like what I say is our body is just telling us to change or do something different. And there's only so many ways it can tell us. So a headache, in a way, I'm imagining, is your brain's way of saying, whatever you're doing, we need to, shift it up. Is that how you would, how do you explain headaches to people? Because obviously this is the $1 billion question, like what causes headaches and what can be done about them?
Yeah. Yeah. So I'm almost to the point, this might, well, I'm almost to the point where if someone comes in with head pain, I associate with the neck almost as much as if you came with knee pain. I'd assume your knee was the problem. Okay. So as far as like,
Which is to say, you aren't just looking there, right? You're not
no.
going to just look at the knee. You're going to look at all the other stuff. For anybody who's listening,
Yes.
yeah,
Yes.
yeah.
So the neck might be the, like, generating the problem, but there's all these different things that have led to it. So one thing we found that's going to answer your question here is when COVID hit, we had to figure out how to be creative and do virtual stuff, and so I started to work with patients virtually, and so no hands-on. Like I can't do any of my manual therapy stuff, and so what I would do is just coach people through what it means to move and have a healthy amount of movement throughout your day. Essentially, that's what it boils down to. And it actually maybe surprised me a little bit, but they got better, and it wasn't as if like the results were like not quite as good. I mean, there are some patients where it's like, yeah, I just want you to come out here so you can work with me in person. But there's a lot of people that we've worked with that have never touched, that have seen marked improvements in their symptoms. And so yeah, that the head pain is very much your body telling you that likely you need to incorporate movement. I mean, there are lots of other dynamics that come to play with head pain in particular. But yeah, if you have headaches or migraines, I would say the first step, and maybe a safe assumption, is to assume that you have some sort of neck tension or irritation, and your body just wants you to move. So we need to get you more dynamic. We need to get you up. We need to get you doing some sort of exercise routine. I want you to get your heart rate up 2 to 3 times a week at least. I want you standing more, like I'm standing here. All those things are going to really, we're seeing them fare very well with our patients.
I love that. I actually was going to make an Instagram reels, which I'll do at some point. And it was like my own experience. Like I had been sleeping in not my own bed, a pillow. I was having a lot of this lower cervical, upper thoracic, just irritation. And I was stretching and all that. And it just was like a low hum, nothing major. And then I did some stuff where I was doing big movements. I had I had 1 pound weights. This was for a class. And I just noticed everything was gone, like literally, and I had stretched and I had massaged it and all these things that manually I know to do and know how to kind of adjust myself. And then it was actually just doing these bigger movement patterns, loading it, unloading it, moving all around. And it just went away. And that was just obviously my own small testimonial, and I'm very balanced, but I think to your point, sometimes it's as easy as that, but people want Not always, but sometimes they just want an answer and a quick fix, and that could be in the form of a migraine pill or something. So, I'm on that note, I'm assuming you get people who have had chronic migraines. And I don't know exactly what that's defined by, but I'm imagining it's like a regular occurrence of a migraine, which I've only had twice in my life. And I only had my first migraine 5 years ago. And up until then, I have to say, kind of sheepishly, when somebody would say they had a migraine, they couldn't do something, I was like, really? Is it that bad? And then I had one and I was like, okay, I had this so I can actually empathize, because it's really, it just makes you feel like crap. So how often are you working with people who have these chronic migraine conditions?
Yeah. So the practice has been open coming up on 4.5 years, and there's been over 600 people that we've been able to help, and probably 80%, maybe even 90% of those come to us with the diagnosis of migraine or migraine with aura. I do think, so if you look at the International Classification of Headache Disorders, there's like dozens of different diagnoses. At least the major ones, we've seen almost all of them and been able to help almost all of them. We have, 80, mid 80% success rate. And by success, it's, we want you to go through a process and feel like you have control over your situation. But yeah, most of our patients are coming to us with that migraine diagnosis, and they're dealing with it. Most of the time it's weekly and maybe daily. So it's not uncommon for us to get, we've had the chronic daily headache diagnosis several times, maybe 2 or 3 times a week, that people are just feeling this debilitating pain. And we've worked with some pretty extreme cases where, they can't work, like they're just depressed, like it just takes over their entire life.
Mm-hmm.
And we have people flying from all across the country, and I say that, not so much to reflect on us, but more so like it's just a huge issue with,
people are
in these people's
desperate.
lives.
I mean,
Yes.
if you're going to fly to another state, that means you've
Yes.
probably sourced all the stuff around you, and
Yeah.
So this is very interesting because when people think of physical therapy, myself included, we're thinking of much more kind of gross motor skills and function. And when you hear of headaches and dealing with that, it doesn't really always seem to fall. I haven't heard of it falling under the physical therapy umbrella, but I think you've already articulated really clearly why it does, which is that movement is a huge part of the medicine for helping a headache. Would you say that's accurate?
Yeah. I would say, if you don't want to take medicine, you have to start moving. So yeah, I guess a basic overview of the mechanics of the neck. So when you turn your head, most people that come to see us can rotate their head and their range of motion looks pretty good. Now, the gold standard of care in a primary care doctor's office is if you can turn your head all the way and it's pain-free, then your neck isn't the issue. Okay. So that's the extent of that evaluation. Most of the patients we deal with, that's true for them. They can turn their head all the way right and left and look up and down side to side, and it's pain-free. It might feel a little stiff, but it's pain-free. And so
it's not a mobility issue, in other words.
Well, it is a mobility issue. There's just compensations. There's, we've got other joints that can pick up the slack, and that's true for really anywhere in the body. And so you're able to compensate. But when it comes to the upper part of the neck, you need to be able to isolate and really understand what needs to happen there. So C1 and C2. So C2 has a thumb-like structure. It sits on C1, which is shaped like a donut, and it rotates. That's its only job. So it does about 45 degrees of rotation right and left. And then the head sitting on the first bone in our neck allows us to nod. And so we should have about 10 degrees of forward nodding. And so being able to look at those joints specifically and understand what's happening there is really the proper way to understand and diagnose like this as a neck issue. But that's why still image isn't really going to do that for us. And so if we stop at like, okay, do you have pain-free range of motion? And we took an x-ray, there's so much more to that story, even just palpation. I mean, you mentioned that sore spot and that suboccipital area. We have to feel that, and we have to understand what we're feeling in order to properly diagnose if your neck has an issue or if there's tension there. Physical therapists, I think this is perfect for what we've been trained to do.
I love it. I love it. So would you say within that, talking about looking at movement and where something should be moving and something should be stable, or where there's compensatory strategies, how much of your time are you spending on teaching more optimal movement? Not just in the neck, but like thoracic spine, shoulders, pelvis, all of it.
Yeah. So it's a part of our treatment with every patient. It's probably because we have to rely solely on it when we're working virtual. It's probably a little bit more robust, but when someone's laying on the table and I'm working on them, that's what we're talking about for the most part. And so, yeah, it's basic things. So when I worked in different outpatient settings, one of the things that I saw as a problem, so if you get your really motivated patient and you give them a list of 20 exercises, like there are people that eat that up. But for the most part, like if we're working with people that are busy, they've got kids, they've got a job, like they can't really like stop and carve out, a half an hour. Like obviously I think we should all have some sense of control over that and be able to do that. But we try to just change the little things throughout their day, right? Mm-hmm. So education on how you're standing, how you're sitting, little movements that you can incorporate throughout your day. And then even just sleeping position. And what I would love, so if you think of the dental industry, they've gotten everyone to brush their teeth and floss. Like I'm really envious of the dental world, and like everyone goes to see a dentist, right? I talked
Here's
to someone.
hoping. I hope they do. Yes.
Yeah. Well, I have a friend who's like, I haven't seen the dentist in like 10 years and her teeth are great. I'm like, well, how do you do that? But anyways, I would love in a sense for like everyone to have their physical therapist and for them to do two things. Like there are two things like brushing teeth and flossing to keep their body healthy as far as the musculoskeletal system and how it moves. So just kind of as an overview, I feel like the prescriptive exercises are definitely helpful. But if we can just get people to think differently throughout their day through that education, that's kind of what we focus on.
So what are the two things that you want them to do? Like yeah.
So it can look different for different people, but for the most part, I want them to do something that gets their shoulders out of this forward posture and their head as well. So like a pec stretch, you can lay on a foam roller, have your arms out to the side. And I love that because you can actually focus on your breathing, breathe through your diaphragm, and you can just spend time there letting gravity pull you back. For some people, I would say like a deep neck flexor exercise, like something to get your neck more stable. But I've actually been leaning more towards really just a basic row. You mentioned that like contract and relax cycle that our muscles should be in. And I'm just seeing these people that their muscles they're never really relaxing. They're just sort of always in some low grade state of having to do work. And so just having them with some resistance move their shoulders through this range of motion. So when it comes to the neck and exercises, I oftentimes look to the shoulders just because all this tension travels, and I'd rather approach it from the shoulders if I'm going to give someone something to do at home.
I love that. I think that's really smart because I agree with you. I think so much of we don't know which comes first, but I truly believe if we kind of look down the chain, we're going to give our neck and our, the position of our skull more of a fighting chance if we give it the structure from underneath that's
Totally.
holding it up. And if you're, collapsed in your rib cage, rounded shoulders, or your pelvis or something, your head is just following that because it's not connected to anything. It's the most distal from the ground. So it really needs the stabilizing forces from underneath to be able to, like you said, relax and let go a little bit. Because I think in a way, and I'm curious your thoughts in terms of like this nervous system as well. I feel like when those muscles, those suboccipital muscles are constantly on, I imagine at some point that your nervous system is kind of feeling like you're in a stress response, even though you could be sitting at your desk doing, nothing, looking at like the New York Times or whatever. But the brain doesn't know any different. It's just like getting this alert that you're constantly, looking around, even though you might not be, because those suboccipitals are shortened and contracted in their effort to stabilize the weight of your skull. Have you found that to be true, that because again, if people have pain, they're going to have more stress. We don't know which comes first, but just from the position, do you think that affects that nervous system response?
Yeah. Yeah. So it's really interesting. We've gone down this rabbit trail of trying to understand the vagus nerve. There are some studies, like I guess early on in our understanding of the vagus nerve and how we can impact it. Like we do know that mechanically you can like stimulate or through like an electrical current or something like that, you can stimulate the vagus nerve, and that vagus nerve is going to regulate our autonomic nervous system. And if it's ramped up, it's going to activate our parasympathetic nervous system. So the neck and neck tension, especially like through this SCM muscle that runs along the front of our neck, and just in general, we know that nerves can be impacted by, the surrounding area. Just think of anyone that has neural tension. How much more likely are they to experience numbness, tingling, or blood flow getting to the nerve itself? And so I think there is some impact on that vagus nerve that might be keeping someone in sort of a fight or flight state just because the function of that vagus nerve is impacted. But yeah,
and also where it travels is right near, the brainstem itself. So that whole kind of compression of that area could totally impact the vagus nerve.
Yeah, totally. And the brain is always getting feedback from our musculoskeletal system. And so I really just think with some resistance, teaching your body how to get in that contracted and then relaxed, like you almost need to give it some resistance in order to let it calm down again. And I mean, you know that better than anyone. And because that's the core of which, or at least I would imagine at the core of what you're trying to do is just get people more stable and their musculoskeletal system to really function the way it should. But yeah, it's definitely going to have an impact on our autonomic nervous system, which just impacts so much.
It really does. It really does. And this area, I mean, you're kind of in the hot zone of all of it because it's where this input-output exchange is happening. And some of that it's almost like faulty wiring. It just, and I think, like you said, it could be small doses. Because again, everything you said, I totally echo. Like there's a few people who are really going to be gung-ho if you give them kind of a prescriptive set of exercises. But more people can actually make lasting and really optimal changes by just making small doses of changes throughout their day.
Yeah. It's really the small things. So for example, I tell my patients all the time, like, I have a standing desk, but I do have a chair as well. And sometimes I'll sit and I'll lean to one side, like I'll cross my legs and I'll lean to one side. My weight will be through one hip, and that kind of slight curvature translates up into my neck. And it probably only takes 15, 20 minutes. And I'm pretty aware of what my neck is feeling, but 15, 20 minutes, then I'll start to feel some level of tension in my neck. And so it's really just, as a physical therapist, we're more aware and we're in tune to what our body's feeling, the impact that it, standing position, sitting position, lack of movement. But I think the general population just sort of needs that education. For example, like relaxing on the couch in the evening in some weird position, that is almost perceived as like I'm giving my body a break. But that can be one of the worst things to do if you've just been sedentary all day and you're feeling sore and achy. I know you want to crash on the couch, but the better thing is going to be to get up and walk at least, or like do some sort of movement. So
I know I talk about a lot. It's so oxymoronic that we can be doing nothing and be tired from that, whether it's sitting on the plane for 5 hours or sitting at a desk and then we're actually exhausted. We've done nothing. And so it really does, we need to think of that as that's our signal that we need to move because we're so stagnant. Our energy's like depleted, having done nothing. We actually have to summon that energy, and it doesn't usually take much. That's what's crazy and amazing is that we can really, I think that's like you just tapped on it. I mean, a lot of people will say, oh, you're so balanced. And I'm like, I think it's really, I'm in tune. And I think if we can teach people to be more in tune with the signals and interpret them in the ways that not literally like I feel tired, therefore I should lay on the couch for 6 hours. More like I feel tired because I haven't done anything. So let me do like 10 minutes of movement, take a walk or something like you were saying. I just, yeah, some of it is like getting to know your body and the signals that it gives and not interpreting them so literally.
Yeah. Yeah, totally. It's, I guess we want to, on my podcast and what we do, we want to empower people.
Mm.
And so it's sort of like bringing all this stuff to, so that it's in reach. It feels doable. It feels like you don't have to, climb Mount Everest or even a 14er. You just
Even
got
a 14er. Ha! He's a Colorado person. Everybody that doesn't know what a 14er, look it up in Colorado.
Pikes Peak is right outside my window. But yeah, it's attainable, and the little things have a huge impact. And I can't emphasize that enough. I mean, it seems so simplistic to be like, oh man, I've got this terrible pain in my head, but if I just stand more, it can feel better. Like it feels too simplistic, but we do it over and over and it works. It's really crazy. So for the people listening, just believe that your body needs movement. If you give it to it, it likely time will start being on your side, and then these things will potentially work themselves out.
So if someone did want to work with you, Jono, where is the best place for people to find you?
Yeah, so our website is our hub. So NoveraHeadacheCenter.com, Novera, like new era.
Yeah. So tell us about like how you came up with that title.
Yeah. So I was just looking for kind of a unique name. Novera is out there, but when I was thinking of a name, I thought of it myself, and maybe those people did for themselves too. But Novo is the Latin word for new, and then era. So new era of what I want my patients to experience, and then kind of what we want to provide as a healthcare provider. And so Novera Headache Center is the name of my practice. If you're looking for something free to continue your understanding of what we're doing, the Headache Doctor podcast is the best way to do that. So subscribe to that podcast. And then on TikTok, I put these helpful short videos of exercises and things. That's under the Headache Doctor. And then on Instagram and Facebook, we're at Novera Headache Center. On the website, though, I mean, if you're local to Colorado, come see us in person. We do have virtual products. We have a course on our website, or we can kind of help with like a health coaching type product as well.
Oh, that's terrific. Oh, that's so wonderful. Well, I'm so happy you're doing this, and how your own curiosity and experience just being around somebody who is helping others in this realm led you to where you are today. So thank you for taking the time and sharing all your nuggets with us.
Yeah, thank you so much for having me on your podcast. This is very generous, and I'm thankful for the opportunity.
All right. Thank you. And everybody, make sure you check out Dr. Jono. And as always, I'm pulling for you.